I must protect our people, safeguard our children, and ensure that a mother's embrace remains full. That is what I am striving to achieve. The measles vaccination drive is underway, treatments are continuing, isolation facilities and ICUs are operational, and our doctors are making their utmost efforts. As you are aware, we are doing our absolute best. Madam, there is no vaccine for dengue. We must manage dengue collaboratively. Our measles vaccination program is running continuously, and we have sufficient stock. Please convey this message to the public. To understand how seriously we are taking this, never before in the history of Bangladesh during such a disastrous period, which I would call a natural disaster, has a prime minister inaugurated a nationwide measles vaccination campaign like this. As you know, our Honorable Prime Minister, Tariq Rahman, inaugurated the measles vaccination campaign on April 20th in Bogora by affectionately holding a crying child to calm them. On that very same day, myself, the State Minister, and all the officials of our ministry administered the measles vaccine across various locations. By this time, we have achieved more than 100% of our vaccination target coverage in most districts. For the remaining 1 or 2 districts, the drive is still ongoing. We are currently making loudspeaker announcements in local areas to call in babies who missed the vaccine, even outside the targeted zones, ensuring that not a single child is left without the measles vaccine. As you are aware, it takes about 3 to 4 weeks for antibodies to develop after a vaccine is administered. We must wait until those antibodies are fully developed. I say this with deep regret, though I will not lament it. That is simply the nature of things, perhaps intended to keep us under pressure, that a lot of misinformation is being published in various newspapers. You are well aware that measles can lead to pneumonia. There are certain cases of pneumonia that are simply not survivable. In such scenarios, as you know, ventilation is our last resort for treatment. We have provided an adequate number of ventilators everywhere. Just today, up to this very moment, we have received a donation of 10 additional ventilators from the United States, provided by a private pharmaceutical entrepreneur. We will be distributing those today. Our measles vaccination drive is ongoing, treatments are continuing, isolation units and ICUs are operational, and our doctors are making every effort. As you know, we are trying our best, and we ask for your continued cooperation. Furthermore, today we received the Chinese Sinovac vaccine, complete with the Chinese government's endorsement. This vaccine has already earned pre-qualification from the World Health Organization. Today we received 7,616 vials, amounting to approximately 308,380 doses of the vaccine. We already have an adequate stock on hand. We will also begin administering the polio vaccine, and there will be no disruption in providing that either. Regarding the anti-rabies vaccine, as you know, we have maintained a continuous supply. Not for a single day has a patient been deprived of the anti-rabies vaccine. No one has been left out, and we continue to administer it. We also recently received our supply of NFCD drugs for tuberculosis. As you know, we have already started utilizing them, and that program is ongoing. Currently, all our vaccination initiatives are fully active. We are experiencing a slight shortage of vitamin A at the moment, but we expect to receive full supplies by this coming June. The pre-scheduled program of administering vitamin A twice a year for nutritional support will, inshallah, continue uninterrupted. We are not lagging behind in this sector at this moment. Madam, as there is no vaccine for dengue, we must manage it collaboratively. Everyone needs to cooperate. We are actively running cleanliness campaigns, and as you know, we have set up mobile hospitals as well. This is to ensure that if the influx of patients increases, not a single patient is left untreated outside. We have set up tents and readied additional open fields and beds. We will fully accommodate them. Please pray that we do not have to resort to treatment and can successfully focus on prevention. Look, our primary hope lies in vaccination, as there is no better treatment than the vaccine itself. It is a continuous process, and we are sustaining it every day. It is not the case that we will stop our efforts once our immediate targets are met. We will actively search for individuals to vaccinate. Even in areas where we have already achieved 100% of our target, which the World Health Organization has formally acknowledged, we are still actively looking for any unvaccinated babies. Look, let me be clear on this. Right now, we are entirely focused on preventing current problems and providing treatment to the people. Personally, I am not thinking about past mistakes or previous activities. Before digging into those issues, my priority is to protect our people, safeguard our children, and keep the hearts of our mothers full. That is what I am striving to achieve. I'm not saying that we won't investigate. Let us face the immediate crisis first and see it through. Following that, it is ultimately a central decision of the government, and inshallah, we will turn our attention to that matter. If we were to become preoccupied with investigating the past right now, people would surely demand that we focus on delivering justice for prior issues.